Okay, so I think we are live now, and I better shut this,
Okay.
otherwise I'll have echo. Okay, and I will start the recording as well. So I think we'll just wait for a minute or so for people to join, and people watching on Facebook, can you hear us clearly? Okay, seems like it's okay. All right, so we'll get started. Good afternoon, good evening, everyone. Just a quick intro on PatientsENgage. We are an online platform which has been operational for 5 years now. We've been focused on holistic and evidence-based management of chronic diseases from the perspective of patients and family caregivers. We've always believed in patients and families being empowered and proactive towards managing their own health. And we've been doing these webinars for 18 months now. These allow you to interact with experts, both lived experiences and people with lived experiences, as well as healthcare professionals. Today, we've got two healthcare professionals because we are talking about a topic which we need to look at as a community, how we can empower ourselves to handle the COVID-19 pandemic. So we have with us two of our panelists. We've got a global health and policy and bioethics expert, Dr. AnantBhan, and we've got a psychotherapist, Vovi Bhagwavar. And they will be answering some of our questions. And as always, you can share your questions in the Facebook chat, or if you're on Zoom, you can put your questions in the chat here. And we will try and address as many questions as we can. Okay, so yeah, we'll get started because I think we have a lot to cover. Dr. Anant, it's now widely understood that the elderly are at greater risk, but besides them, who are the people most at risk of being infected?
Thank you, Aparna. Thank you for having us. I think, we are learning a lot about the pandemic and the way it pans out also in clinical settings. But I think the evidence seems to indicate, yes, as you pointed out, that the elderly are especially at risk, but also those who might have compromised immune function for whichever reason, right? So they are on medication, suppresses their immunity. They've recently had chemotherapy, or they are also having multiple comorbidities. Especially so, I think there has been some evidence which indicates that people who might have diabetes, hypertension, cardiovascular disease, especially if it's in a more advanced stage,
Right.
might be people who might be at risk. And I think so, and also probably people with chronic respiratory diseases. In any case, I think because the infection also probably pans out in different ways for different people, it's always better to be cautious and not feel that you are protected in any way just because you don't fall into any of those categories. But yes,
Right.
especially those individuals who might be older, those who might have comorbid conditions, and especially so respiratory or cardiovascular and diabetes should be careful, and also obviously anyone with lower immunities because of any other existing condition or medication.
Right. Right. Okay. Thanks. Vovi, what are the risks that people with existing mental health issues should be aware about, and how can they handle the situation?
Firstly, thanks, Aparna, for having us here and having this session so we can educate so many. So, yes, that's actually a concern that a lot of people have been sharing. And as a therapist, I've been seeing too, people with already existing anxiety disorders. So, how are they reacting to this pandemic?
Right.
So, on the internet, you'll find a lot of information about obsessive compulsive disorder and coronavirus, because that's a group that has been in a lot of ways affected by the news and the information that's being shared. Now, as also a lot of people with health anxiety disorder, so
Right.
they've seen a peak in their anxiety too. So the dictate to follow with them is that you continue with the medication and psychotherapy as has been going on, right? And maybe take an increase in sessions to help the anxiety. The second thing is there are certain norms that have been laid down universally for all of us to follow. It doesn't
Right.
exclude any group, and this group also is part of that group. Following the social distancing measures, following the norms of cleanliness and hygiene, all apply to them too. For this
Hmm.
group, I'd be a little cautious about the amount of information they're taking in from the internet because they are
Right.
they are prone to reading up anyway a lot more and
Hmm.
believing what they read and also applying what they read. So maybe, getting in touch with the news twice a day should be enough so that they keep themselves informed. That may be one
Right.
way to keep their anxiety in check. As also understanding that the healthcare professionals are a call away. They need to be in touch with them and not take any action themselves to
Right.
solve the problem.
Okay. Thanks. And you talked about, the social distancing. Dr. Anand, can you just explain in layman's terms how these measures of social distancing actually help flatten the curve, as people are saying? And uh, yeah, let's go with that first, and then I'll ask the follow up.
Sure, sure. So I mean, in any kind of infectious disease spread, and especially of this kind, which is primarily being spread through respiratory droplets, what you're trying to prevent is those with infection spreading it to other individuals who are obviously not infected. The one way
Right.
of doing that is obviously to try to prevent contact between those who are infected and those who are not. And that is typically what social distancing is trying to accomplish. What you're trying to say is that if there is someone, and sometimes you don't even know who is infected or not because they might be asymptomatic, as we have seen in many cases. Only few
Mm.
people will show symptoms also because some of them might have a very mild illness, but they might still be carrying the virus and be able to spread it. So you need to then institute basic measures like keeping a minimum distance between you and someone else. And ideally, it should be anyone else because anyone could be infected, especially in public places where you might know who you're coming across. And so the idea being that if you are able to do that and you're trying to minimize contact, especially physical contact with other people who might be potentially infected, you reduce the chances of you getting the infection. Now, obviously, that doesn't work in isolation or in you need to do that. Or you need to also take accessory measures like basic hygiene, frequent hand washing, ensuring that if you come in touch with any surface which other people might have also touched, like if you're traveling by bus or metro, then the handrail, or if you're going to a public place like purchasing something in a market, then any of the surfaces which might be available there, basically anything which you're not sure of who else is regularly touching that, then you before you touch anything around your face, especially your lips, eyes, and nose, that you disinfect your hands. And the most effective way to do that essentially is hand washing with soap.
Right.
You can use a sanitizer if hand washing and soap with a soap is not practical or feasible at that point of time. But where possible, that is the best method. But then again, remember, once you've finished hand washing, how you dry your hands is also extremely important. So either you do air drying, which is basically
Hmm.
put your hands up and let them dry by themselves for a few minutes, or you use a tissue which then you dispose of, which is a fresh tissue, or a napkin, which is a personal napkin only being used by you, something like that.
Right. Right.
And so these
Thanks.
social distance, sorry, just to add on,
Sorry.
the social
Sure.
distancing measures can also involve some kind of coercive steps which the government might implement. So part of that is also then steps like isolation for those who are confirmed infected, and quarantine for those who might have been exposed and potentially could come up with the infection. So that is another step to try to come up with a physical distance between those who have the infection and other individuals, which is why you have quarantine wards or home quarantine, and similarly isolation wards in hospitals. The idea being you minimize that possibility of transmissibility of infection.
Right. Right. And it's understood now, I think, but just to reiterate that masks only help if you already have uh, symptoms and you don't want, or you have the droplets and you don't want to pass them on to others, right? It doesn't help the other way.
Yeah, I mean, I think there's most evidence seems to indicate that everyone wearing masks is not going to make a huge difference. But
Hmm.
yes, masks do need to be worn by those who might be having symptoms of COVID-19. In
Right.
fact, it's true of if you have any kind of respiratory illness, viral in nature, then it's a good practice to have a mask on. But what kind of mask do you wear, whether it is worn effectively, how you touch it, how you put it on, how do you dispose of it, is also important. So yes, patients with viral infections, especially
Right.
COVID-19, it would be good if they use a mask, a good quality mask at that. But also equally importantly, those who might be frequently coming in touch with such patients, so or in contact with such patients. So that, for example, would be healthcare workers. So it's
Right.
advised that healthcare workers in hospital settings should be using personal protective equipment, one element of which is a mask.
Mask. Okay. Okay. Thanks. And in a country like ours, which has high population density plus a very high informal sector where things like work from home is going to be challenging for sure. Um, is there any guidance or evidence that the flattening measures will take a longer time, or they could be as effective as it would be if it was much more, more draconian measures like China did?
Yeah, so I think for us, time will probably tell. I think, we might need to do a little bit more of innovation, as you're saying, that density of population is a big concern, and also work from home is not a possibility for a large section of our population, especially the informal workforce. But then, depending on which profession you might be in, for example, if I'm a courier delivery executive or a food delivery executive, then there have been some suggestions that you can still institute measures like no contact delivery, which is to
Mm,
say that if I go into a household and I have to do a Uber or a Swiggy or a Zomato delivery, then I just ring the bell, leave the food order at the doorstep, and I do not directly come in contact with the individual who has made that order. But that
right.
requires the cooperation of both the customer and also the delivery executive, and obviously some degree of information being given on a prior basis, which educates them. So similarly, those who might be sanitation workers who are collecting household waste, you can also again have something similar where the trash is left at the doorstep, and you don't necessarily need to come in touch with the person who's collecting as well as the person who's giving, who's handing over the waste. Because I think there is a slight class issue here. People might tend to think that the infection is only coming in by those individuals who are
Right.
the delivery executives or the trash collectors, but it is actually the other way around. So the risk is on both sides, and it's important to not stigmatize, because it's very easy in gated communities to make rules like, well, no, from tomorrow onwards, no household helps are allowed inside, no courier folks are allowed inside, and there is
Correct.
no real public health basis to that. I mean, if you would rather do more evidence-based measures, that would probably be a brighter idea. And so things like that can be done. And at the same time, there has to be some accountability. For example, at least, industry quality gloves can be given to waste collectors, because
Mm,
at least then they do not need to, their bare hands don't come in touch with the trash, which might have been recently in contact with someone who has an infection, and then they
right.
wash their hands at the first possible opportunity. So again, I think it's for each profession and the persons responsible and contractors to also institute measures, at least minimum distance between individuals, not having 100% workforce but working at maybe 50% or 40% workforce, or having different shifts. Things like that can make a difference.
Okay. Thanks. Vovi, one of the challenges we are seeing within families are the different perceptions of risks and attitudes towards risk, right? So even within a family, there may be one person who is very cautious and then another person is not so cautious. Um, Sometimes, the young son or daughter may not want to be constrained or may not want to kind of follow social distancing. Sometimes people think that their elderly parents are not careful enough and they're not listening to them. How should a family navigate this whole discussion around, what is acceptable risk, and especially because we are going to be spending a lot more time together, right? So, um, or, dealing with this for an extended period of time. So, Havovi, Havovi, can you hear me? Sorry, I think we've lost her for some reason. Okay. Dr. Anand, do you want to kind of talk
Sure. So
about
maybe if
it
you want to,
while?
sure, why don't you reframe the question again, and then maybe I'll try and respond, and while we try to get Who are we on?
Yeah. So I guess what I'm trying to understand is, uh, we have two uh, kind of extremes and, various people in the middle on different levels of risk, um, perception and attitudes. Um, is it irresponsible to be on one end, and should more people be, is it better to be more cautious at this point in any case?
Yes, I think it's important to be cautious. I think India has been lucky in many ways that we've seen a relatively less number of cases for the size of the country and also our population. Now, that has been a lucky break in terms of also the time made available to us to institute measures of public health prevention. If we do not heed to that and do not take this seriously, then I think we could easily set us up for a rapid spread of infection. And I think that is something a lot of us worry about. So in
Right.
Madhya Pradesh, where I'm based in Bhopal, we haven't yet had a case in the state officially. And so,
Mm,
people seem to be carrying on with life normally. There's not much you see in terms of social distancing. But
right.
if worst case scenario, a few cases end up being identified and then there is a spread of infection, that would be probably too late in a way to do much. So I think we need to do that prevention aspect now. And if that requires us to do more and more education, that is important. The Prime
Right.
Minister yesterday came out and made a clear set of statements asking individuals to be careful and saying we we in India are not protected in any special way and we are also susceptible. So hopefully, with that being reinforced at multiple levels, people will pay more attention. But also, it's I don't think anyone has seen this in their lifetime. This kind of
Correct.
spread, and
Correct.
the kind of measures we're starting to see. So it's also probably things have been slow on the uptake, but hopefully we'll see more compliance moving forward.
Okay. Sorry, Havovi, thanks for coming back. Did you hear my question last time, or do I need to repeat the question? You didn't get
No,
the
I
question.
lost the
Okay.
connection.
Okay,
Yeah.
so what I was saying was that, within a family, there are different perceptions of risk and attitudes towards risk, right? So uh, one person may be extremely cautious, the other person may not, might have a more, say, chalta hai attitude, or somebody who's a youngster might have a different attitude. Sometimes people think their elderly parents are not careful enough. So how should a family navigate this period? Because this can cause a lot of stress within the family as well.
Yeah, I think that's a great question because one is the forced proximity. That's
Mm,
not easy for a lot of people to take, especially because they've been at work. They find that suddenly coming together and staying together in one unit for such a long time may not be very easy. I think one of the
mm,
most important things to remember is even what our PM said yesterday, and then what the CM has also said of Maharashtra, is that we're fighting a war. This is no more about what's happening between us, but we all have to come together in solidarity against a common enemy. And at this point, that's the virus. It's nameless, it's faceless, it's spreading. We don't know where it is. So I think
right,
assuming a stance that's pretty much united is more important than anything at this point. And just as during any crisis, and like Anand said, we've not seen something like this during our lifetime. We also have to start acclimatizing to it. But
right,
it's important to remember to just stay united during this time and adopt the same stance together as a family, right? That is in terms of what they are going out to do, that has to be restricted, as also who is going to get the provisions. Can the provisions be brought home? Can we restrict, maybe eating a lot of fancy food right now? Can we restrict the walks downstairs? Can we do activities together internally in the house? It's very important, for something called, which we don't do this much in India, which is sit together and make a plan, not individually, but together, right? Like a
mm,
family meeting, and decide how you're going to spend the day. Because apart from the family unit, many people, especially in the coming few days, are not going to be seeing much of the outside world.
right,
And we need to find ways to keep ourselves engaged without getting into quarrels and unnecessary arguments, which happens when
mm,
you're in close quarters. And for everybody, there has to be a stance now that they are infected. And if you are infected, then how would you act? You would act to
Right.
protect the people that you love, and you'd act to protect the people around you as well as yourself. So if our mindset changes like this, things are going to be very different. It's literally a matter of just changing the way you're approaching the situation. Because the
Hmm.
situation is what it is. It's not going to
Right.
change.
Right.
Yeah.
Right. Yeah. Okay. Thanks. Thanks for that. Um, Also, with the postponement of a lot of the critical exams, I think yesterday youngsters are going to be very stressed. So again, what can the families do to support them?
Ironically, their anxiety has reduced. Now, I work with a lot of teens and a lot of parents. The
Mm,
last week was especially tough because these kids didn't know whether they prepare for a paper and tomorrow there's a lockdown. So you imagine the
right.
state they are, it's like so much uncertainty. Now, in the last day, somewhere that certainty always gives us a sense of hope and gives us a sense of completion. So
Right.
a lot of students are feeling okay. We know now, that we don't have to prepare for the exam tomorrow. It's indefinite. We don't know for how long. But yes, it's an extremely sad place to be in, especially for those students giving their boards. They've actually battled with a lot of stuff to go out there and give exams among 150 students crammed together in one room with one
Right.
invigilator. They've been under these conditions. They don't know what is going to happen to those exams, whether they've written them in the right state of mind with all of this preparation. So it's very tough. One of the things that I'm able to help parents with is to understand that this is temporary,
Hmm.
and that if they have either one exam or two exams or three exams, the students have to at some point go and give those exams.
Right.
So they need to keep a balance of steadiness because summer holidays have not started yet,
Hmm.
and they yet need to understand that they have to keep in mind that they have to be still in exam mode to some extent.
Right.
And
Right.
a lot of students are panicking about much ahead, such as their applications,
Hmm.
those giving their 12 boards. A lot of it has been held, on hold, put on hold. So they have to start thinking about what they're going to do in the future, and
Hmm.
check with career guidance counselors for the information they're receiving from universities abroad.
Right.
Universities abroad are issuing certain types of norms about how they're
Hmm.
going to handle students coming in, because a lot of students have already taken admissions, so they need to follow up with all that.
Right. Okay. Thank you. I think just taking in a few questions that are already starting to come in. How to sanitize the grocery we get from outside? I know there's a lot of WhatsApp going around about putting, the greens in potassium permanganate, washing vegetables in water with soda, and so on. Is there any, specific benefit to that, Dr. Anant?
Yeah, so I would do it the same way I do it regularly. I don't think you need to do anything extraordinarily different. It's just that you need to be careful about surfaces and things. So you disinfect your house on a regular basis. You clean surfaces. You clean anything which comes from outside, right? So the same way I would treat vegetables which I buy off a market before I consume them, I would exactly do the same thing, and just with maybe more frequent hand washing in between. That is what I would advise. I don't think we need to get into panic mode around everything which we encounter on a daily basis. It's just that we need to be a bit more careful about how we approach it. But I don't think we need to worry about doing some extra steps just because this is happening. More
Right.
importantly, I think what is beyond those WhatsApp forwards, we just need to be careful that we don't go into panic mode, because I think that by itself is something which is more of a worry for many of us than the
Correct.
possibility of us getting infection from vegetables which we
Absolutely.
have bought.
Correct. Yeah. So I think however we earlier said that you should limit your social media engagement to maybe once or twice a day. Maybe that is a good idea. So
Yes.
one other question was, how many times can we use the N95 mask? I know we've already said the limits of what masks can do, but do you want to answer this specific question?
Yeah, so typically any of these masks are meant to be used generally only for a day at most.
Hmm.
But it also depends on how you use it, and what is the purpose of using it. If you are a lay user, I don't think maybe using it for slightly extended periods is fine. But someone who might be in a healthcare facility, for example, whether you're a healthcare practitioner yourself or you're visiting because you need you're essential, it's essential for you to get there because you have a patient or a relative who you are visiting, then you might want to follow the same norms which healthcare workers have to do, which is, ideally single use.
Right, right. Okay. Um, I know we've touched on this a little bit, but just wanting to reiterate the message around because there is a lot of recognition that, or there's a lot of talk that the young people are not as much at risk. So why should they take social distancing seriously as well?
Okay, that's a good one. I don't think
Really good
anyone should
one.
yeah, yeah. So I don't think anyone should assume that they're immune to COVID-19. I mean, we have now enough number of cases all across the age groups. Yes, the seriousness and the deaths have been more concentrated in the older age group and in patients with comorbidities, but infections have been happening across the age groups. And even if you were theoretically less likely to get the infection, um, when I say the infection, I mean the serious manifestations of the disease. You could still be subclinically infected without disease, but you would be spreading the infection. So while
Right,
you might not be at risk, you would put everyone in your family at risk, especially those who are older to you, your grandparents or senior members of the family. So you might end
right,
up being a victor, and which is why everyone needs to be concerned and everyone needs to be worried. So everyone needs to follow the same precautions, and especially so if you are living with a larger family where there are individuals who might be more susceptible. So I think the standard rules apply to everyone. Let's not feel any of us is special
right.
in being able to protect this.
Yeah, and I think the point about the fact that even if you can recover quickly, you're still putting others at risk, right? So, that is, I think, something that again we need to all be aware of. Is India, as a question that we've got, is India as a nation doing enough to deal with the pandemic in terms of healthcare readiness, tests, and making arrangements for equipment such as ventilators?
Yeah, so I think the response has been variable. I think some states have done relatively better. Kerala is a good example of a state which has capitalized on its experience with Nipah outbreaks, the two Nipah outbreaks that they handled. And also the first three cases, if we all remember, were in Kerala. And
Hello.
they've actually had a very good systemic response, which has been led by the state level minister, the bureaucratic leadership, and the health system working closely with communities and community representatives. So that's a good example. Overall, on
Right,
as a nation, I think it's a mixed bag. I think on things like testing, we've not done very well. Many of us have argued that testing should be much more expanded. It's not been there. It's slowly improving on that front. I don't think already our health system is in a bit of pressure. So if we reach a stage where there is a requirement for a lot of ICU beds and ventilators, I think we would very soon face an acute shortage, even if we were to work with the private sector. So the only silver lining we can create is hopefully one, try to prevent the spread of infection or the speed with which it is spread, so that you are
right,
able to actually plateau it down. And so the number of beds you might require at any one point of time is not too high, and that does not overwhelm the system. But I think in recent times, I think there's been a more overt focus now from political leadership. Hopefully, they're starting to get the seriousness of this situation. So the kind of steps we are seeing in states where they're putting in, these measures around suspending travel,
right,
suspending, access to places where people congregate, whether those be religious in nature or malls and the like, is an attempt by them to make sure that we are preventing the spread of infection, and hopefully that will
correct,
help us. But
right.
we will certainly face a challenging time. The extent of which it's difficult to predict now, but it's better that all of us gear up for potentially a serious case scenario.
And should people proactively delay elective surgeries or going to hospitals for anything routine unless it's necessary?
Yeah, ideally you should. I mean, I think there, if anything, which is you think or your clinician, your healthcare professional you work with is something which is elective in nature, which is not emergency in any way. then you should be delaying it. One, for because we want to preserve our health resources to focus down on this issue of COVID-19. We also
Right.
want to keep the emergency services running, because just because there is COVID-19 doesn't mean that there wouldn't be other emergency cases. So we should be
Mm.
focusing down on that. And the third reason being, you would be potentially exposing yourself to infection, because the patients will be reporting to these facilities, especially larger hospitals. So you would potentially be at a higher risk by going into hospital settings or clinic settings than you would be by staying at home. So unless there is an urgency, unless there isn't a way that you can get, for example, your medication to continue, there is a major side effect that you're feeling, or you need to change your medication, try and reach out to your clinician and see if you can talk to them and get some advice remotely. And if not, then try and find out a time when there might be less crowd at the facility.
Right.
Ideally, at the hospital side, also they need to do some planning. For example, you might want to decide which section of the hospital is meant for respiratory, individuals with respiratory complaints. And then you
Right.
try to wall off that side so that you minimize the contact which other patients might have with someone who's potentially having a COVID-19 infection. So it's not just the responsibility of the patient in the community, but also the institutions to respond
Institutions.
and also
Right.
communicate that. Because if
Right.
you don't know, then how will you know? You might as just
Correct.
probably walk in the regular way I do it, unless I know what I should be doing.
Right. Correct. Correct. Um, so we've got a question specifically with respect to seniors with pre-existing conditions. Is there any need to increase or decrease exercise or change diet to reduce chances of getting infected?
Yeah, I think you should be, you should do what you do regularly. Exercise is always a good thing. Now, whether you are able to do it in a public space versus a private space might be one thing which changes. So if you can do exercises at home, which you are comfortable with, it's always a good thing. You should stay on your medication, especially if your disease condition is under control. You should eat healthily, and at regular periods of time, reduce your stress. As Rovi was saying, don't go into panic mode. Don't take too much anxiety, and just stay calm. This will last for a while, but it will end at some point of time. So I think as long as most of us just remain composed through this period, I think we will pass it okay. If you are facing challenges in any of these, then obviously that is the time to report to a healthcare facility
Hmm.
through a professional and seek advice. But otherwise, I don't think you need to do anything extraordinarily special. Just do what you do normally, but
Right.
keep your schedule. Keep to your schedule and try to keep yourself engaged, because it is going to be tiring if the social isolation period lasts too long, and that is probably going to have an impact on people's mental health. And maybe more we can talk a little bit more about how do you deal with that,
Yeah.
especially normal people who are not used to just staying at home for this long.
Yeah. So I think, yeah. So just to follow up on that, and we would be good to hear you as well, because normally people do go out for walks, especially the elderly, and if that's also being curtailed, then it is a problem. Especially, it increases the isolation as well. I think a lot of gated communities or condominiums have kind of said you can walk with your family but not with others. You can't walk with neighbors, etc., which is typically the way most Indians tend to walk, is with a group of people. So any advice for them would be great.
So, people are treating the isolation with a lot of, I would say, panic is one, but resentment, yeah,
Hmm.
that's a word that I've been seeing a lot. And like I was saying, and I've been reiterating this, that the mindset has to be slightly different. We can't change, what we have around us. For example, if we have to do the things that we did and we have to make some changes to our routine, then it's for a brief time so that this doesn't become a longer period of isolation. We're making sure that we are staying isolated for 2 or 3 weeks just so that we don't spread this into the community and worsen things for us. So I think an attitude of what we call as radical acceptance. which is that something is happening and we accept it. And if we
Mm.
don't fight it, or we think that our anger and our resentment and our annoyance is going to change the thing outside, then the only people to suffer is us. So psychologically, the impact of not accepting things is more on the human than anyone else. So if we just accept that this period is there and we have to make slight changes to the way we normally do things, then we can go through this period, with a lot of calmness, togetherness, community, and maybe find new ways. For example, I go to a yoga class every single day, right?
Right.
And our yoga team has shifted to doing online Skype classes. If you told
Right.
me that something like this would happen a year ago, I'd laugh, correct?
Mm.
But she managed the entire thing beautifully. We were all at different locations and it happened.
Right.
We can engage our creative minds to come up with things, but emotions come in the way of this creative thinking. So it's important to engage the right kind of emotions at this point of time. And
Okay.
healthier emotions, a healthier mindset, very important.
Right. And the same thing, I guess, would apply to, we also have kids who are not being allowed to go down to play, right? So even though in some cases walks are being allowed, but kids are definitely not being allowed to play because they would get exposed and touch equipment, play equipment, and so on. So again, what's the advice for in those scenarios?
Children are actually going to be impacted by this, not in this period, but in the long run. So I've been
Mm,
writing up a fact sheet for children, and we've like put across some questions to children in the community, and the anxiety among them is spreading as well, spreading from parents to them. And
mm,
for a child, stability is the most important thing, right? We
right.
humans who are adults, right? If things get unpredictable, we cope. Children don't
Mm,
cope. They don't understand unpredictability. It's for them a lot of safety comes into place. So a month later or 6 weeks later, we can anticipate that more problems from kids are going to come if we don't handle things correctly and wisely and maturely right now. So if your child is irritated and doesn't want to stay cooped up at home, then we need to explain why this is happening. A lot of parents and a lot of adults, maybe because they're anxious, maybe because they don't have knowledge, they just lay down rules. This is to be done,
mm,
follow it. But children adhere very well to rules when they know why. So
mm,
if I don't go down to play, why is it that I don't need to go down to play? What am I going to be doing? So we need to explain to them that they are soldiers themselves and that they are helping us fight this war. And if we explain it to them in a nicer way, in a way that it engages them, they will cooperate. And you can set up Skype dates with other kids and they can play things. There are
right.
online sessions that can be conducted for children.
Right.
In fact, in the last 4 or 5 weeks, 4 or 5 days, you will see that there are a lot of coaching classes as well as online gaming of the good nature, not the
Mm,
other,
right.
other nature happening, as also things like piano classes, chess coaching. A lot of things have started suddenly happening online. So we can do it. I mean, as a
Right.
community, if we work together, we are diligent, we are focused, we are empathic, we can get through this.
Right. Right. I guess the other community which is also going to get impacted is people who are employed, but who are looking at the economic impact of COVID-19, right? Which is a global impact. It's not going to be unique to India. And it has caused stock market meltdowns. Corporates are affected. There's a lot of uncertainty. Again, how should again, what can they do to deal with this scenario, because this is again a long term play.
So, Aparna, I'm not sure one of both of us are wondering whom the question is
Oh,
directed
sorry. Yeah. So I guess, Ovi, you can go ahead and answer first, and then.
to. So, yeah, this is going to be, in fact, it's reminding me a lot of the 2008 crash, the way people are reacting right now. Yeah, that's
Mm,
when the economic meltdown really happened. There was so much panic and pandemonium.
right.
And again, the same things, the anxiety disorders, those roles, the death rate rose, which is really sad. Um, then relationship problems increased, right?
Mm,
I'm sure we have to learn from the lessons of other countries and make sure that we are, I mean, the numbers are very encouraging today. So if an
right.
economic meltdown has to happen, we hope that it won't happen at the extent that we are seeing other countries suffer. As also, the measures that the government is taking has to be strengthened. It's not
Mm,
as stringent, but there are a few things we need to remember, which is different in our country from others, which is that the labor force is very high.
right.
And essential commodities are yet not supplied through a more, you can say, distant medium. They're still supplied at a very, very personal level.
Right.
So we have to keep that the economy is going to suffer at that level. The same thing that when demonetization happened, it's that sector that really got affected.
Correct. The informal
We have to
sector.
keep
Yeah.
the informal sector is the one that's the one we need to watch out for, and at an
Right.
individual level and a government level, start really watching out for them.
Right. Um, okay, thanks. Dr. Anant, there's a question. Do you think warm weather in India will help stop the outbreak?
Yeah, so I mean, I think there is a little bit of unknown to that, but I think it's quite clear that the infection has also spread in countries with warmer weather and humid weather. So while we can hope for the best with the incoming summer, I don't think we can depend on it. Generally, yes, viral infections do go down a little bit in the summer, but the COVID-19, the coronavirus, the novel coronavirus, which is responsible, seems to be not, behaving exactly in the same way. So I think it's better to be
More
cautious
robust.
and yeah, it's better to be not dependent on that premise and just wait it out for the summer to hit in and then start partying, assuming that it's over.
Right.
But I think it's fair to say that we don't know. But till date, I think WHO has discounted that theory and suggested that hot and humid weather is not necessarily in any way protective. So it's better to be
Right.
safe than sorry. Let's see how things change over the next few months. But if we just depend on the weather, that's not going to serve us. So we need to
True.
keep doing all the other things that we talked about over the last
Right.
half an hour or so, and that's more important right
Okay. Yeah, so there's also a question of there is some concern that of the people who have recently traveled being ostracized and treated harshly. And we know that we've also seen, I think, two people who killed themselves by suicide. Um, you know what are the consequences of such panic behavior, and how can we curb it? And I guess both of you have experience from the HIV/AIDS experience as well. So again, what can we learn as a community? Dr. Anand, do you want to go first, and then?
Sure. So I think I mean, in our fight against anything like this, we have to be extremely careful with that stigmatization and discrimination is in no way an answer. It is not
Mm,
going to help. It will push away people from accessing testing, accessing care, following quarantine or isolation requests. Um, so we've already also started seeing cases where people have left quarantine facilities or not adhered to quarantine requests. It doesn't help to brand people as well. I've had some issues also with recent initiatives by some state governments of putting in stamps and the like,
right.
or bans for that matter. I don't think we've
Mm,
done that in any infectious disease scenario. I mean,
Yeah.
putting HIV, Ebola, MERS, SARS. I mean,
mm,
I don't know what is,
correct.
there's nothing different about
Correct.
COVID-19 that we need to go in for anything like that. It just seems to
Right.
indicate that we feel that, we treat everyone as an infant who needs
Mm,
to be regulated, right? So I think it's more important to actually work with people and try to help them understand why it is important to take on individual responsibility and what is the
right.
reciprocal obligation of the state, which is to say that if
Right.
I want you to be in quarantine or to isolate yourself, then what is it that I'm going to assure you that you have access to water, safe water,
Right.
food, communication, ensure that you have regular medical care being provided, that there is someone who's checking in on you, that you don't feel a mental health strain just because someone has abandoned you and said that it's your problem, get isolated for 14 days or get quarantined for 14 days. So I
Right.
mean, there is a lot to learn from the past. I mean, this kind of stuff has happened with XDR TV, for example. We have examples from Ebola as well. So we can learn from the experiences of other countries and try and extrapolate how do we make it easier for people to adhere to those norms. But
Right.
by stigmatizing them, by discriminating against them, by creating a fair psychosis about potentially being someone who's infected, who could be hounded for that, then I think we're going to scare away people. And already, we've already heard of 3 or 4 scenarios where people have gone to large public gatherings,
Mm.
um, despite already being exposed, even if they
Correct.
did not, whether they were infected or not. But they came in
Right.
from a high risk setting, either travel wise or otherwise, and very much putting other people at risk. So I
At
think if
risk.
people understood and really realize, and as how you were saying, if we can work with small kids to make them understand why they should not be going downstairs to play, by actually explaining things nicely to them, we should be
Mm.
able to do it with adults as well.
Right. If a so question from somebody, if a suspected infected person, I guess the question is, would it make sense in a place like India, instead of having to go to a crowded government hospital for testing, would it make sense for labs to come home to collect samples? And again, only works because in India we look at we're used to labs coming home to collect samples. So would that be an option that would make sense?
Yes, I don't think you can. I mean, I'm not sure whether the government will go in for that doorstep collection of samples. I
Hmm.
don't think they have the wherewithal or to be able to do it.
How will they
I,
control numbers?
yeah,
Yeah.
Yeah.
numbers is going to, and actually the infrastructure required is going to be quite complicated.
Crazy.
To get
Right.
someone to come in, and that person ideally has to assume that you might be infected, has to wear
Correct.
personal
And the
protective
entire,
equipment while collecting that,
Right.
which is not very easy. I mean, if anyone's worn it, you will know that it's uncomfortable.
Mm.
It's you feel hot, and it's not something you can put on for too long without wanting to take a break. So if they
Right.
have to come, if they have to, not all of them will have air conditioned limousines to drive in, and they'll come by motorcycle and this stuff, right? So
Correct.
the
Correct.
practicalities is a bit more difficult, but I think the government is working on involving private labs, and
Right.
that might take some time. Once that happens, then you might have more access to avenues where you can get tested. But still, I think it's very important for people to recognize that it should not be the case that you just, it's not something you just pick off a counter in terms of, I go and get
yeah.
tested. It should be
Hmm.
modulated through a healthcare professional. Many of the
Right.
symptoms in COVID-19 are exactly the same you would have in another, like common cold
Hmm.
or fever and things like that. So it's better to just go to a professional and let them decide and use their clinical discretion whether you actually need to get tested. But yes, if you
Hmm.
have a strong risk element, you've traveled abroad, you're starting to feel symptoms, you have been exposed to someone who's confirmed infected, you should certainly get tested, and the system will help you get there. So I think that, but that
Right.
also needs to be communicated more clearly by the government so that people know who should be going in for testing, where they should be going, so that they don't end up going to a government hospital into a general OPD and walk around asking for where can I get tested. That is going to put them
Correct.
as well as
Correct.
other people at risk.
Correct. Correct. So I think I know that informally again, certain doctors have started offering online consultation, telephone consultation to help people figure out whether they need to go. But I don't think there's a systemic process set up as yet on this. But Hovi, a question for you: how does one prevent getting into depression and anxiety in these situations, especially with, well, they've used the term extreme quarantine and isolation, although I don't know why they're using extreme. But anyway, yeah, that's the question.
So the first thing is we are all not quarantined.
Mm.
That's something I think a lot of people are attaching so much importance to that word. We are, again, it's a matter of mindset, because quarantine is like somebody's imposing this rule on us, and we've done nothing wrong. Though we're
Mm.
not infected, we are supposed to just give up on all the things we love and all the things we like, and then go into our homes and stay there for no fault of ours.
Right.
So that's really not what we are doing right now. We are doing
Mm.
physical distancing so that we
Mm.
prevent the spread of the virus into the community, and so that we don't burden our healthcare system, and we
Right.
take care of the elders. So we really need to have that attitude. People who have, again, pre-existing depression and pre-existing anxiety often have lower coping skills because they're still developing those coping skills through therapy or through the guidance of their psychiatrist. They may go into temporarily into a zone where they feel a lot more symptoms emerging, such as they don't want to get out of bed, they don't want to do the things they did earlier. There's not much to do. You don't want to go out, or you're constantly reading up on the news, as happens with people with anxiety. You give up the rest of
Right.
your life and just keep doing that the entire day. Those people need to take a little more care of themselves, right?
Right.
How do you prevent getting into depression and anxiety? The same things you do normally, right?
Mm,
You'd engage with people. You'd, if you can't engage with them personally, you'd engage with them in other ways, right? Call
right.
them up, speak to them, understand how they're doing, find out, the health of your relatives, engage with people the best you can, and most importantly, engage with yourself. Because
Right.
one of the ways that depression and anxiety sets in is because there's very little reflective capacity. People find it tough to go into themselves and understand why they face what they face. So this is a good
Right.
time to use, to journal, to understand what your thought processes are, to recognize what kind of negative thinking can lead you into a pitfall. And I'd say it's a time when you can do reflection and use terms like go within, reflect, rather than using terms like quarantine or isolation, because these negative terms only make us feel more negative.
Right. Thank you. One question which I think is everybody's favorite question is, and there's again a lot of information that comes around on WhatsApp. Are there home remedies or for uh, preventing or treating this or fighting this virus?
I've come across at least 100 on WhatsApp
Yeah,
so far.
yeah. I
Everything
think I've
ranging from
lost.
ginger,
Correct. I've lost count of how
from
many things you can use, but uh, Dr.
even the
Anand,
Dettol.
sorry, go ahead, Hobi.
There was one on Dettol, which I think people are taking very seriously, Dr. Anand. And maybe we can educate them about it. There's something written behind a Dettol bottle. Did you come across that?
Yeah, I think I saw some forward. I mean, I've been trying to avoid those forwards. So I think the best,
So they're really
so the best home remedy is to take all of those forwards and trash them. Uh,
that the
but
best remedy to take is to trash them. I would agree.
Uh, yeah, but remember, the people, anything they write, so the coronavirus is a very, it's a family of viruses. Even your common cold
Yes,
virus is a coronavirus. So
absolutely.
just because something claims that, it worked for coronavirus doesn't mean it will work for a novel coronavirus, COVID-19, right? And more importantly, I don't really think we have evidence about anything working specifically. Yes, you can try to keep yourself healthy, which is by just doing normal things you do to keep yourself healthy, which is
Right.
exercise, take care of yourself, sleep well, eat in moderation, just take care of your mental health. That
Mm,
certainly, anything which keeps you in a healthy state and boosts your
Yeah,
immunity is good. But beyond that, anything, any kind of magic remedies, pills that you can pop, or vegetables that you can mix up in your kitchen, I don't think it's going to make much of a difference. Just eat healthy, and that should be fine. And don't trust
right.
those forward. Just rely on verified information. I think people can easily fall for some of this misinformation. There might be commercial entities which are trying to take advantage. Already one sees some ads like that in newspapers. Please don't
Correct.
trust them. There is no evidence so
yeah,
far. There are
Right.
some antiviral agents on which studies are happening. There are some malarial agents on which research is happening. But let's wait for those results to come. Let's not believe, even just because something might have worked in 3 patients doesn't mean it will work for the rest of humanity, even if it has
Correct.
been the case in somewhere in Italy or China or wherever, right? So wait for evidence to come through, and then once that is confirmed, hopefully that will be made available. But don't try that at home.
So one of the other things that causes a lot of anxiety, I think, is all the information that's going around on the models that talk about how big this could be, right? So, and this morning or last night, actually, Dr. Fossey of the NIH said that while some models claim that it can go up to 50%, he thinks it's unlikely because in the past, pandemics have rarely gone beyond 15 to 20%. And also, these models don't take into account the measures that are already being put into place. So, should the common man heed these models? Should we even be discussing them as laypersons?
Yeah, so models exist for a reason, and I think we should let professionals do that modeling. It helps because it might help take some policy decisions. It also gives you an estimate of where things could go. But there are also models which are fraught with uncertainty. So
Mm,
the numbers that you're seeing, no one can say that that is how actually it will pan out. But it's
Mm,
good to be cautious. It's good to know that if you don't really do things well, it could easily head that side. And we've seen country examples like Iran and China earlier, where the
right,
numbers really rose quite heavily, and Italy is also now facing a major issue, right? So it's
right.
certainly good to be cautious. Yes, you can listen into the numbers, you can look at the numbers, but more importantly, if we get our basics right, I think we can tackle those numbers. The other thing is, I think we need to we need to avoid complacency. Experiences with SARS, with Nipah in India show us that if you institute these measures but you stop them too early, then there can always be a resurgence. And I
Mm,
think people have learned the hard way in many countries. So we need to also know till when we need to institute those measures so that we are able to control the spread of infection and hopefully
right.
prevent a resurgence, because you don't want it to come back with vengeance, right? You don't want it to come back with maybe some kind of viral mutation or anything,
Correct,
because you
correct.
were not taking the prevention measures seriously enough. So yes, the projections could go anywhere from 10, 15% to 50%. It depends on what expert you're listening to. But
Right,
beyond the numbers, the same requirements exist around how we can try to tackle that. Just basic public health measures and being responsible citizens and ensuring that the state is responsive to the kind of things it needs to do, which is to ensure things like personal protective equipment for healthcare workers, more testing being available, keeping beds ready just in case we reach that worst case scenario, etc.
right, right. And I think there still is a lot of questions, but I know that we have only 3 minutes left to go. So just one last question. I know we've seen a lot of local community support step up to support elderly. We've had groups being formed where they're looking at how they can help people deliver stuff and so on. But on the other hand, we're also seeing shortages in blood banks. There have been requests for blood by the thalassemia group. There have been requests for platelets by Tata Memorial this morning. So, what are the steps that you think the community should be taking to kind of get us through the difficult situation? Hovi, can I start with you first?
yeah, I think as a community, if we work together, things should be fine. And just like in a time of crisis, like Dr. Anand was saying earlier, we need to make sure that we are approaching a healthcare center only if it is required. So that
Mm,
is, I think, the most one of the things it was said in the PM speech yesterday also. That's very clearly something all of us are probably flouting, crowding out hospitals. Just like there is panic buying, there's a lot of panic in this area, the health
mm,
area as well. So that has to reduce and even out. Then I think across the next 2 or 3 weeks, we should see some kind of balance set in.
mm. Okay. Dr. Anand?
Yeah, so I tend to agree. I think there's a lot communities can do, and I think generally as communities we are very responsive to appeals of that kind.
Mm,
What is required is sort of maybe some channelizing, so that we have trusted sources which let individuals know there is a shortage of platelets, there is a shortage of blood, there is a shortage of anything which people can volunteer for, and then figure
right,
out corridors where through which that can be fulfilled. So that,
right.
for example, if there is a shortage of blood, then can we have a specific camp which is for collection of blood, which is not necessarily in the hospital, because that
Mm,
reduce, you're trying to reduce the chance that someone will be exposed to infection. So you do a
right.
remote camp where blood is donated, and then that blood is taken back to the facility for processing. So things like that can be organized, but it's good to have some forecasting. So if we know in advance that 2 or 3 weeks down the line we might be seeing shortages of blood products, then the usual volunteer network which exists for of blood
That's
donors
true.
is then leveraged for that purpose. And I think
Right.
people will find that very I think all of us are trying to find purpose right now in
Mm,
terms of how we can contribute, because we all recognize that this is something all of us will need to respond to. This is not something which just the government can tackle. It will require all of us to contribute, and part of that is, yes, following requests for social distancing, but also stepping forward when there is a need. So if you can play a role in any way, I'm sure many people would be willing to do it, but they just need to be guided in the right way. that is where I think leadership of institutions or of existing volunteer networks is important.
Right, right. So, yeah, I think we will need to wind up. So thank you very much, Hovovi, as well as Dr. Anant. I think we've answered a lot of questions. I'm sure there's still a lot more to go, but uh, we know that, you have sessions planned and so on. So again, thank you for taking the time and helping the community understand what they can do.
Thank you, Aparna. Thank you for having us, and
Thank
best
you.
wishes, and take care, everyone. We shall overcome. It might take some time, but let's keep strong as a community.
Correct. Yeah. So I think
Thanks,
we'll all
Aparna.
remember that we should be responsible. Thanks, Hovovi. Thanks.
Thanks so much. I think this is a great venture, and I hope a lot of people see this. And Dr. Anand has spoken about so much that has, put many of those doubts to rest. So let's hope we can do more as a community.
Yeah, I think
Stay
both of
safe,
you have
stay
people.
home,
Yeah,
Yeah,
stay
I
safe,
know.
stay calm.
It's a very good
stay
discussion. I
safe,
learned a lot as
stay
well. So
calm.
thank you.
Yeah.
Thank